Right, like coal, but that's C-O-A-L.
Listen, the more you know. We have Dr. Barone with us here, so now you're going to slay that cosmetic wheelhouse trivia if it ever comes up in your world.
I'll try.
So there you go.
It's an honest answer.
Yeah.
All right, so Dr. Barone joins us from Evolv Plastic Surgery and Medical Aesthetics, as he does every month. Okay, you ready for the questions?
All set.
Okay, here we go. All right, let's put the question up here on the board. Question number 1 for Dr. Barone. Who can legally perform cosmetic surgery?
Well, many people are surprised to find out that any physician can legally perform cosmetic surgery. Typically, that would be in their office or clinic where there's no jurisdiction. So the state medical boards don't supervise who's doing what, even if they haven't been trained officially in doing that surgery. They can do it legally. So this gets to be very confusing when patients are trying to decide. Having cosmetic surgery is a very personal choice.
Sure.
So it gets very confusing for patients because they don't realize that. So very important to check out credentials.
So you're going in for a flu shot, and your doctor could be like, hey, would you like an eye lift too? I mean, that's technically possible?
Exactly.
Oh my gosh.
So any physician can perform that legally.
Right.
So the board gets involved if there's a problem or a complication or an injury, then they come in after the fact. But ahead of the time, anyone can do that.
So that kind of opens the gates a little bit here. If somebody is getting something done, of course, there's many levels of cosmetic procedures. Is there anything that they should be looking for specifically, or maybe run the other direction if they see X?
Well, first I would say be aware of this too good to be true price shopping when you see things marked down a lot. I mean, having plastic surgery or a procedure is not a commodity like buying a car or getting the best deal. It's a very personal thing. And so we should look for who's doing it and whether they've been trained in. But it gets very confusing with social media and marketing. People can't tell sometimes what to train. They have all these boards that aren't official boards. There's only certain official boards by the American Board of Medical Specialties, like pediatrics and plastic surgery and neurosurgery. Well, there's a lot of other boards, we call fake boards, that have been put together specifically because the patient will think it's a plastic surgeon doing it when it's not, in fact, the truth.
Wow. So you got to do your research. You got to really do your homework before you go somewhere.
And we're seeing with the huge increase in cosmetic procedures and plastic surgery, we're seeing more injuries reported because there's just more demand than there are qualified providers to give it. So it's a little scary. You have to be very careful.
Yeah, do your homework.
Normally, I mean, it's a very safe procedure if it's done by someone who's properly qualified. Extremely safe, very good, predictable results.
Okay.
The problems come in when people look for these deals or price shopping, go out of the country, or trying to get a lower price. And usually the lower price is because the person isn't qualified to be doing it.
Sure.
Or they're doing it in a facility that isn't credentialed, or they're using products that are not the best quality products and technologies.
Right. We have time for one more. We have time for one more question here. Let's go to number 2. This one, why does the cost of procedures vary so significantly? So this would follow kind of what we were talking about, trying to find deals. How does the same procedure cost different at different places?
Oh, cost is affected by primarily who's doing the procedure, and generally the less experienced or not credentialed physician or provider would offer a lower price to try to lure patients in. Or they're doing it in their own clinics when the surgery should be done in an accredited licensed operating facility. Or they're using products like with breast implants, we see lower quality implants, or Botox that gets diluted, or other types of ways of cutting costs that aren't in the patient's best interest, but the patient will never know that. They just think they're getting a great deal. But it's not about getting a deal, it's really about making a highly personal and potentially life-changing decision.
So homework is what we're gathering today.
Exactly, but you got to be extra careful because even people who do their homework sometimes get confused by marketing that is intended to deceive and not to inform.
Scary. Well, Dr. Frank Barone, thanks so much for being here today, sharing your expertise. We appreciate it.
Thank you.